Hello everyone. Today, we're delving into the world of a medication called Etodolac, commonly known by its brand names Lodine, Lodine XL, and Etogesic. As always, our discussion is for educational purposes only. If you have health-related questions or concerns, it's important to seek advice from a medical professional. Description: Etodolac, known by its generic name and various brand names such as Lodine, Lodine XL, and Etogesic, belongs to a class of drugs called nonsteroidal anti-inflammatory drugs, NSAIDs. It's primarily used to relieve pain and reduce inflammation in conditions like osteoarthritis and rheumatoid arthritis. Approved by the FDA, it's available in both immediate-release and extended-release formulations. Etodolac works by inhibiting the production of certain natural substances in the body that cause pain and inflammation. It's typically prescribed for short-term relief, and dosage varies depending on the condition being treated. While it can be effective for managing pain, it's essential to be aware of potential side effects and interactions. Warnings: before using Etodolac, it's crucial to understand its precautions. NSAIDs like Etodolac may increase the risk of serious cardiovascular events, including heart attack and stroke. This risk may be higher if you have underlying cardiovascular conditions or if you're using it for an extended period. Therefore, it's essential to use the lowest effective dose for the shortest duration possible, especially in individuals with existing heart problems. Additionally, NSAIDs, including Etodolac, can increase the risk of gastrointestinal bleeding, ulcers, and stomach perforation, which can be life-threatening. It's important to discuss your medical history, including any gastrointestinal issues, with your healthcare provider before starting Etodolac. Before taking this medicine. Prior to starting Etodolac, it's vital to disclose any allergies to NSAIDs or other medications, as well as any medical conditions you may have, especially if you have a history of heart disease, high blood pressure, stomach ulcers, kidney disease, liver disease, asthma, or bleeding disorders. If you're pregnant, planning to become pregnant, or breastfeeding, it's essential to consult your healthcare provider, as NSAIDs may not be recommended during certain stages of pregnancy. Additionally, inform your doctor about all medications, supplements, and herbal products you're currently taking, as they may interact with Etodolac and increase the risk of side effects. Side effects: like all medications, Etodolac can cause side effects, ranging from mild to severe. Common side effects may include stomach upset, nausea, vomiting, diarrhea, dizziness, headache, and constipation. However, more severe side effects such as gastrointestinal bleeding, ulcers, kidney problems, liver damage, allergic reactions, and cardiovascular events like heart attack or stroke can occur, especially with prolonged use or at higher doses. It's essential to seek medical attention if you experience any unusual symptoms while taking Etodolac. Interactions: Etodolac may interact with other medications, including other NSAIDs, blood thinners, corticosteroids, selective serotonin reuptake inhibitors, SSRIs, and certain medications for high blood pressure and heart conditions. It's crucial to inform your healthcare provider about all medications you're taking to avoid potential interactions and complications. Dosage: the dosage of Etodolac varies depending on the condition being treated, the formulation, immediate release or extended release, and individual response to the medication. It's important to follow your doctor's instructions and take the medication exactly as prescribed. Do not exceed the recommended dose or duration of treatment without consulting your healthcare provider. Regular monitoring and follow-up appointments are essential to assess the effectiveness and safety of Etodolac therapy. Avoid: while taking Etodolac, it's advisable to avoid alcohol, as it may increase the risk of gastrointestinal bleeding and liver damage. Additionally, avoid taking other NSAIDs or pain relievers without consulting your doctor, as they may interact with Etodolac and increase the risk of side effects. FAQ: many individuals wonder about the age restrictions for Etodolac. While it's generally considered safe for adults, its safety and effectiveness in children and adolescents have not been well established. It's essential to consult with a healthcare provider for any specific questions or concerns regarding the use of Etodolac in pediatric populations. Closing: that concludes our overview of Etodolac. Remember, this information is intended for educational purposes and should not replace professional medical advice. If you have any questions or concerns about Etodolac or your treatment plan, be sure to consult with your healthcare provider. Thank you for joining us today.